Hey everyone, and welcome back to The Advisor. I am so excited today. We have Dr. Susan Landers back with us. She has a podcast on our channel called Moms Matter. And today's topic is one that it's going to speak to a lot of you. So today we're diving into a topic that doesn't get talked about enough: marijuana use disorder and cannabis hyperemesis syndrome, which is so hard to say, and how these two can impact babies. So, from addiction to cycles of severe vomiting, cannabis use in pregnancy and early parenthood carries serious risks for both the mom and the child. So, today we're going to unpack what these conditions are, why this awareness matters, and how families can make safer, healthier choices. Before we get started, I want to say thank you to Dr. Bradley Nelson and iHeartRadio for your sponsorship. And I just want to give a big welcome back to the show, Susan. How have you been doing?
Great, thanks. I'm great, except for my overly excitable lab puppy.
Yes, yes, he's almost a year old.
Yeah, yeah. He'll settle down soon.
What's his name?
His name is Rudy.
Rudy. Okay,
And
is there a
he
meaning
he could
behind that?
no, he could actually use a little marijuana to settle him down a little, but I don't know anything about marijuana or cannabis use in dogs, but I've read quite a bit about cannabis use in teens and young adults and pregnant women. So I'm ready to talk about it.
Well, I'm excited. So, what exactly is marijuana use disorder?
Marijuana use disorder is a lot like alcoholism. It's a
Okay.
lot like an eating disorder. It is when you are literally addicted to using marijuana. Usually it's when you use it every day, you've tried to cut back and you can't. It is affecting your life and your work. You spend a lot of time trying to get it. You're spending a lot of money getting it. You require more than you used to get high. That's called building up a tolerance. It may make you feel really irritable or anxious, may make you have trouble sleeping. Usually, people with marijuana use disorder have given up certain parts of schooling or certain aspects of work and hobbies. Sometimes they even forsake social events because they'd rather get high. Clearly, driving while you're high is a sign of use disorder, just like DUIs, DWIs are a sign of bad alcoholism. So when people continue to use marijuana, even though there are physical and psychological problems associated with it, that's what's diagnosed as marijuana use disorder. And guess what? Here's the big news for this audience. It occurs in 10% of regular users. So
Wow.
if you've got a teenage kid, mom, or a young adult kid like I did, and they're using every day and using more and more, and it's affecting their life and their schoolwork or their job performance, you really need to think about whether or not they're using so much that they've developed cannabis use disorder. Cannabis is the generic name for marijuana. Tetrahydrocannabinol is the chemical that makes us get high or feel great. So, cannabis is the umbrella term for marijuana use and marijuana products. I don't know much about the difference between what you smoke and what you vape and what you eat in edibles, except that most edibles are supposed to be less potent. But the fact remains any source of marijuana, any source of cannabis is going to affect your brain. And there are cannabinoid receptors in our brains. And if we use a lot, we could get addicted. 10%, that's really high, Lisa. For 10% of heavy users, whether they're teens, young adults, older adults, to become addicted, that's scary. That is
That is.
almost as high as alcoholism. So think about things like diabetes, asthma, anxiety, severe depression. Those are all occurring about 10% in the general population.
Right.
So cannabis use disorder or marijuana use disorder is about as prevalent as lots of other public health issues, but we're not talking about it.
Yeah. And I was just telling you, there's literally a cannabis store at every corner in my city. I swear there's more
Yes.
cannabis stores than Tim Hortons now. I just see like it's like flamingo they make it look so vibrant and it's like welcoming
Right.
and colorful. And
Yes.
it's very, very inexpensive to purchase these products as
Oh,
well.
is it really?
It's
Is it
very inexpensive.
inexpensive? Is it inexpensive even for the products that have more potency than in the old days? Like back when I was in college, you had to smoke a lot of stuff to get high. Now, my daughter tells me it's very potent. So, are
Yeah.
the products that are more potent still inexpensive?
It's very inexpensive. It is. They have different
Mm.
strains. There's sativa and indica, which are two different kinds. Sativa is like an energy drink, and
Huh.
indica is like in the couch. So it's gonna relax you and make you
Huh.
feel really, really chillaxed is the point of it. But
Yes.
you walk in these stores and there's like they just glamorize it. Like I said, there's like
Mm-hmm.
gummies
Mm-hmm.
and the packaging is beautiful.
Oh,
But
wow.
it is potent. It is potent. You don't need much.
Yeah. So, in my reading about marijuana and where we stand today in the US with legalization, people know that a lot of the states have legalized recreational use marijuana. Many more have legalized medical use. And so I wanted to look up by age group and even by political affiliation who supported the legalization of marijuana. And
Oh,
as you would expect, young people aged 18 to 34 now support legalization of marijuana 80% of the time.
wow. That's
Democrats
a
tend to
huge
support
statistic.
80 compared to more middle-aged folks, 35 to 54, about 70% are pro legalization. And older folks like me, 55% are pro legalization. The progressive Democrat tends to be more in favor of legalizing. Republicans tend to be less in favor of legalizing. And when you ask groups of people what they think about marijuana, young adults think it's positive. They don't
Right.
think there's anything wrong with it. And so, for the moms out there with teens and young adults, please be aware that there is the potential for addiction and harm. And it may be that your teen or your young adult needs to talk to somebody about their use. I want to tell you a couple of stories. One of the ladies in my exercise group came up to me, oh, several months back, and she said, my daughter's having trouble. I don't know what's going on. She had just finished college and she was back in Austin working at a new job. And she said she just keeps vomiting and she just has these bouts of vomiting and abdominal pain. And it doesn't stop. And once we had to take her to the emergency room where she got IV fluids and nobody knew what it was. They thought, well, maybe it's gastroenteritis, but she didn't have any other symptoms. It happened again like 2 weeks later. She was going off to some trip with some friends and had to go to the emergency department again for severe
Wow.
vomiting. She finally confessed to her mother that she was still smoking marijuana. I think she was vaping at least twice a day, every day, like she had been in college. Now, she made good grades in college, she graduated, But this vomiting, this cyclical vomiting called hyperemesis, really revved up. And she was adjusting to a new job. The third time it happened, she went to the ED, and a resident who wasn't scared to ask her about her marijuana use connected the dots. And he and his attending doctor decided she had what's called hyperemesis cannabinoid syndrome. That is where you have a lot of vomiting, cyclical vomiting, abdominal pain. It happens the more you use marijuana. Again, 10%, that statistic, 10% of young adults have been diagnosed with this. And you have to go to the emergency department for fluids. Some people say that very hot showers and very hot baths will make the patient feel better. But there's no cure except for stopping smoking marijuana. And so my friend got her daughter to see a psychiatrist. She was smoking marijuana because of anxiety, which so many people are. And
Pain
she
and anxiety.
stops,
Yeah.
yeah, she stopped smoking and her cyclical vomiting went away.
Wow.
Now she's on an anti-anxiety med and she's seeing this therapist and she's doing a lot better. So that's one big problem we're seeing in chronic marijuana users. The other big problem is something that happened in my own daughter. My youngest daughter did great in college for the first 3 years. She had a roommate that smoked a lot of dope, weed, and the roommate kept saying, "Your anxiety's out of control. Why don't you smoke some marijuana to calm down?" And so she started smoking marijuana. I don't know how much or how often, but I do know that her senior year, she stopped going to classes. She didn't complete her work. Sometimes she didn't show up for tests. She told me she wasn't very motivated to finish school. She had completed 3 years of college with good grades. When she was home, she would avoid responsibility. She withdrew from social activities that was going on with her group of friends in the sorority. And her grades fell. I mean, she
Mm.
flunked everything the first semester. She came home over Christmas. The college put her on probation and they said, "You've got to get your act together. You've got to pull your grades up or we're not going to let you graduate." She went back to school, still smoking a lot of marijuana, unknown to us, and she failed again. She
Wow.
did not do any of the work. She did not finish college. And I remember her crying and telling me she was so sad watching her friends get ready to graduate. And it took us a while, Lisa, to figure out that she had what's called amotivational syndrome. Chronic cannabis use can cause some users to stop being motivated, to stop feeling responsible, to not complete work, to procrastinate. She acted emotionally flat and she was also very irritable. She had withdrawn from seeing friends, not just bombing out of college. When she was home, she was miserable. She didn't get together with any of her old friends. She didn't want to deal with anything. These symptoms were classic for amotivational syndrome. And we got her some help, and she got put on a good anti anxiety medicine, cut down on her marijuana use. I don't think she stopped completely, but she cut down enough so that she could function and went back to college at a different college. But that whole episode was so scary for me as her mother, not knowing how to counsel her, not knowing what was wrong. Here she had completed 3 years of college with good grades and then flunked out her senior year. I mean, that's really a big deal. And so these two cases told me here are two young women who were doing pretty well, both smoking marijuana to control their anxiety symptoms, both got in significant trouble. One lost her college degree, and one ended up in the emergency room several times. This is this is not nothing. For people whose teens and young adults smoke marijuana, I want you to be aware that these sort of complications can occur. They're usually in people who are smoking a lot, smoking on a regular basis. High potency products tend to contribute. A young age when you start smoking. Did you know that if a teenager starts smoking at 14, 15, 16, they're way more likely to get addicted to marijuana when they're in their 20s? That's
Oh, wow.
scary. Yeah,
Hmm.
that's really scary.
It's
So
a, it's
I
like
wanted,
dependency, right? It's that dependency. It's that
it
feeling
is,
of not feeling, and then
yes,
just knowing that that's there. And then life is full of stress and ups and downs and feeling, and to have something, knowledge that you can easily take something and that's going to all melt away.
right.
That's powerfully dangerous.
And it's not a drug like you get a drug at the drugstore and you know you're taking 20 milligrams or 40 or 60. You're taking a chance with how much you get, depending on whether you're smoking or vaping or eating the product. And what if you're taking more and more and don't realize it? So I just want people with teens and young adults to recognize that this is a potential and to have some honest conversations with your teen or young adult. How much are you using? Is it affecting your life? Are you using it every day? How much money are you spending on it? How's it affecting your behavior? I mean, those kind of things can be discussed by parents and teens and young adults. And they can be discussed without threatening the teen. I mean, it's like drinking. The person who's using alcohol, the person who's using cannabis, has complete control over their behavior. They do. And so it's a matter of helping them figure out whether what they are doing is harming them in any way.
Yeah, it's almost like figuring out the reason behind it. If it's occasional recreational use with your friends, that's one thing. But if it's to fill some sort of void, then it's a
Yes,
matter of figuring out what you need in your life in order to fill that void. Because that's not going to
exactly.
fill a void. That's going to make the void even bigger.
Right. It's going to make everything worse. Now, we know that pregnant women, you
I was
mentioned at
just
the
going to ask,
beginning, yeah,
yeah, how
pregnant
does it
women
affect
who
pregnant women?
have pain or who have nausea tend to turn to marijuana to relieve their nausea. Even though the American College
Really?
of Obstetrics and Gynecologists recommends against this. A lot of young women, remember, young people tend to think marijuana is positive in their lives. A lot of young women who are pregnant and who have nausea will use marijuana, and that's okay intermittently, every now and then. Does marijuana, does tetrahydrocannabinoid get into mom's bloodstream? Yes. Does it cross the placenta? Yes. Does it have problems for the developing fetus and baby? Actually, yes.
Mm,
Moms who smoke a lot of cannabis tend to have babies who are born premature or low birth weight. Now,
interesting.
yeah, sometimes these studies mix up cannabis use and smoking cigarettes. Smoking cigarettes also increases risk of prematurity and low birth weight. But there's some new studies that show that children who were born to moms who were heavy marijuana users, daily users, those children have behavioral abnormalities at age 5, 6, 7, and they have lots of behavioral problems and learning problems in school at school age. So
So
think
stuff
about
like
this.
ADHD, ADD, like the inability to focus,
Yes.
That kind of thing?
Yes.
What types of
Yes.
behavioral issues? Okay.
I think it's learning specifically numbers, learning language, reading. I'm not positive about those details, but in my Mom's Matter newsletter, when I wrote about this, I included some references about those long-term studies of children who were born to moms who had really significant use during their pregnancy. So we're just beginning, now that legalization is all over the country, we're just beginning to get enough studies to look at the children who were exposed to marijuana while they were fetuses inside their mom's womb and follow them for the number of years we need to see how it affects them. But some of the studies are clearly showing side effects, learning disorders, behavioral disorders, small birth weight, premature birth. Now, what about breastfeeding? Does
Mm,
does cannabis go into mom's breast milk? You betcha, it sure does. And it is held up in the fat cells, and breast milk has lots of fat in it. So when mom smokes marijuana, her breast milk will contain tetrahydrocannabinol for up to 48 hours.
wow.
Some studies have even shown it lasts longer, like days and weeks. But in general, most folks say that if you're going to breastfeed and smoke marijuana, you should pump and dump at least 48 hours. Some studies suggest it stays in the breast milk even longer. The American Academy of Pediatrics says no marijuana use while breastfeeding. Do, do new mothers who've just delivered a baby want their baby to take breast milk that is tainted with marijuana? Do they want the developing brain of their newborn to be exposed to a drug which alters the brain?
Yeah.
That's the question we should ask ourselves during pregnancy and breastfeeding. Do we want not only to medicate ourselves, which is fine, I guess, if you're not pregnant or breastfeeding, but when you're pregnant or breastfeeding, if you do that, you also medicate your baby. And I want moms to understand that occasional mild use happens. I know people are out there doing it. I know pediatricians are hearing from mothers that they use it occasionally and they're talking about breastfeeding, and the pediatricians are saying, try not to breastfeed for 48 hours after you've had a marijuana party or a big use. But for all the other times, I want the moms to think about they're actually inhaling a drug that crosses the placenta, that goes into their breast milk and goes straight into their baby. And that's not a healthy thing for a developing brain. If it's
No,
not a
not at all.
if it's not a healthy thing for a teenager, and we know they have significant side effects from marijuana use, where the teen is smoking themselves, 13, 14, 15, 16-year-old kids. We know those kids are having all kind of learning and behavior problems. If it's not good for the teen brain, why do we think it's good for the newborn brain? It's not. Still a developing brain. And so I want moms who use it occasionally to keep in mind that the less they use it for whatever symptoms, the better off they'll be. And I've written a blog post on my website about other ways to calm down during pregnancy if you're anxious, other ways to take care of your nausea while you're pregnant, so you don't have to use marijuana. There are some other home remedies that work really well. There's some medicines that your obstetrician can give you that do not harm the fetus. And so it's important for moms, especially, to think about what they're smoking in the context of transmitting that medication, if you will, that substance to the baby.
Yeah. And I want to bring up, I have a story. So my
Okay.
former partner's ex-wife, that's hard to say, that's a mouthful, was babysitting. Okay.
Yeah.
And her daughters used gummies, like marijuana infused
Uh-huh.
gummies occasionally. And these gummies taste like, the 5-cent candies that you can buy at the convenience store. They taste
Good.
amazing. And there was very young kids in the basement, and they got a hold of these and ate them all.
Oh,
And half an hour later, one of the kids is like, I feel funny. And
yes.
then she noticed what had happened and panicked and brought them to the hospital. But I think it's
Good.
important for us to reiterate that if you do have those in your home and you have young kids around,
Yes.
to keep them locked up, keep them in a cupboard that is not
Yes.
reachable. Make
Yes.
sure you do that because they taste better than any candy I could ever
Right.
imagined. Like they're
Right.
so
Right.
good. And
Treat
so
it
kids are
like
going to
it's
eat those suckers
Tylenol.
up. They're
Yeah.
gone. Yeah,
Treat it
exactly.
like it's Tylenol or baby aspirin. Lock it away. People love The Pit, which is a new show on HBO Max about the ER in Pittsburgh. And one of the vignettes, I love that show. It's so realistic. One of the vignettes is about a 4-year-old boy who comes into the ER. He's obtunded. That means he's almost in a coma. He's so out of it, he
Wow.
doesn't respond to anything. They figure out through the talk screen that he's got sky high marijuana levels, and the mom and the dad figure out that the dad had some gummies in his shirt pocket that his brother gave him, and the kid got the gummies and ate them. And so the 4-year-old had to go into the ICU and get treated before he woke up. So it was a realistic vignette, exactly like the story of your friend's children.
Yeah.
They're dangerous. It is a medication, it is a substance. And whether it should be a controlled substance or not, I'm not going to get into that. I mean, probably it should be legal for people over 18, but I want people over 18 to understand all the ramifications of using marijuana. My friend's daughter, my daughter, pregnant women, we have got to get the message out that this is not a nothing drug. Everybody thinks it's a nothing drug, that it's safe, that it's effective, that it's fun. I just don't think that's true. I think we have enough information now to ask people to be very, very careful with this drug.
Yeah, anything that alters your brain chemistry and causes you to be intoxicated is doing something to the chemistry of your body, which
Exactly.
that can cause permanent damage.
Yeah, it
I know
can.
people who've smoked so much that they actually became like they had symptoms of psychosis. Like they were
Oh,
paranoid. They
that.
couldn't leave their house.
I've heard about that, but I didn't read anything about it. There is a psychosis that occurs in heavy, heavy marijuana users. So, well, we've talked about so many things for people to be aware of, especially if you have a teen or a young adult who's using, especially if you're pregnant and think you need to use marijuana, especially if you're breastfeeding. Please check out my publication on Moms Matter about marijuana. I have an article on my blog about marijuana to try to get the information out that this is not a nothing drug. This is a something drug. And I know people have heard about cannabis hyperemesis syndrome. I know people have heard about amotivational syndrome. I know people have friends who have these conditions. It's caused by too much cannabis. I'm sorry,
So
I'm a Debbie
before
Downer today.
No, I love this. And thanks for coming on here and being brave enough to talk about a subject that not everybody's willing to talk about. I think it's a very important message to get out. I guess my next question to you would be, what is something someone can do if they suspect someone they love is struggling
Hmm.
with any of these disorders and or they're pregnant and overusing? What are some just simple things that someone can do?
Well, if you're the parent of someone who's using, you can try to talk to your loved one in a non-critical, non-confrontational way. Here's what I'm seeing. I'm worried about you. I've been reading about. Can we talk about how much you're using? Can we talk about whether you think it's affecting your life? I mean, there are lots of ways parents can calmly ask their teen or young adult about their use. Pregnant women can take advantage of resources that are published about using anti-anxiety medicines in pregnancy, about using other medications to control nausea. There are some herbal teas that are very good for nausea. And so I think the thing to do is to investigate your symptoms and whether or not there are other things you can use to treat your symptoms if you're pregnant or breastfeeding. And for parents of teens and young adults, it's really having a conversation prefaced by, I love you, I'm worried about you, and tell them you've read about these things and you're worried that their life might be affected. They might deny it, but they're going to listen. They're going to listen to what you say and maybe go look it up and read something about it when they're alone. But for parents to say, I'm worried about you, for a husband to say to his wife, I'm worried about you smoking marijuana while you're pregnant. I just don't think that's a good idea. Can we talk about this? Can we look up what the effects are? Um, I think the first place to start is non-critical conversation in a loving way so that people who use marijuana for certain reasons can think about the consequences.
Yeah, I agree. There's a warm, gentle approach and just yeah, I'm worried about you. Let's talk about this. That's always the
Yeah,
best way.
yeah, it is.
Yeah.
Yes,
So
it is.
where can people find your website?
My website is susanlandersmd.com. I have a blog there, and lots of the blogs post things about pregnancy, breastfeeding, marijuana use. I have a newsletter that's free, Moms Matter. You can sign up on the website, you can sign up on Instagram, LinkedIn. I have lots of places on social media that I visit. And my newsletter, I publish once a week topics that matter to moms. My newsletter is called Moms Matter, like the podcast. And I love to answer questions. On my website, there is a form to contact me. So, any parents that have questions about any of these topics, please shoot them my way. I will try to answer them or hook you up with a person who can answer them. I still believe in the general population, average people, getting information to understand risk and benefit. Everything comes down to risk and benefit. If we think marijuana is beneficial, has a positive effect, that's fine as long as we understand the risk and as long as we know how to look for the consequences. So everything in life is risk benefit, especially where a chemical or a medication is concerned. Does that make sense?
Yeah, absolutely. Just like everything. Everything,
Uh-huh.
most things have a little bit of a risk and a little bit of a benefit, and you just got to choose which one is weighing more on the scale.
Exactly. Exactly. Yeah.
Yeah. So before we go today, if you could give one message to a new parent or an old parent about cannabis use in children, what would that be?
Be careful with marijuana and keep it totally away from children because they're going to eat it, they're going to taste it, they're going to smell it. It needs to be locked up like anything else. If you're pregnant or breastfeeding, please get some information about marijuana use during pregnancy. Go to my website, go to the American College of OB-GYN, ACOG, or AAP. And for parents of teens and young adults, get some information, have that conversation. Don't be afraid to ask your loved one how much they're using and whether or not it's affecting their life. This is your child, even though they're 25 or 30 years old. It's their brain, and you can tell when they're acting funny. So I just think people need to be honest and to try to seek information. Information is power. It really is.
Thank you so much for being here today. And again, for talking about a subject that not a lot of people talk about. It's important.
Yep, it is. And you're great to tell your story of your friends, children, and to listen to me tell my stories.
Yeah, I think it's relatable. And when people can
Yeah,
relate to what we're talking about, then it makes it less scary. So the
yeah,
more we can get these messages and these stories out to
yeah,
the world, the more people are going to feel like they're not alone.
exactly. Well said.
Yes. And to our audience, thank you so much for joining us today. You just heard from Dr. Susan Landers. Her podcast is called Moms Matter, where she goes into such great detail on so many topics that a lot of you, new moms, old moms, want to become moms, anything mom, would love to hear. So go back on her channel and check it out. And if you find yourself reaching for a substance when you're stressed, I'm going to speak for the two of us here. We challenge you to think about why you're reaching for that, and perhaps
Mhm.
there's a better, healthier way. Until
Right.
next time, take care, everyone.
Bye.